And one thing I should have mentioned the other group, this is mammary tissue on the, it's not an internal structure, it's on the surface. And so for our species, the mammary tissue is primarily over the pectoralis major. For many quadrupeds, it extends in it all the way down from the thoracic cavity, or the surface of the thorax down to the abdomen. Okay, so if I reflect back the digestive organs, this is the bladder there, and you'll see coming up from underneath the bladder, and it has nothing to do with the bladder, just where it is anatomically. You can see the left fallopian tube and the right fallopian tube. And then the fimbriae is that very complicated part of the fallopian tube, and you see it surrounding the ovary. Similarly, this one's kind of laid out in a different, kind of hold it back. There's the fimbriae, and there's the ovary right there. If I hold back the bladder, these are what are called the uterine horns, and they come together to form the uterine body. Now, remember, from an organizational standpoint, you have urinary, reproductive, and then digestive. So the urinary is going to be, in this case, close to the ventral surface, and then reproductive in between, and then digestive will be most dorsal. So here's the bladder, and therefore that's the urethra. Okay. Now this is, if I kind of put the probe on top of the uterus, you can see it leads into the vaginal canal. So that's urethra, that's vagina, and if I pull a little bit on the sigmoid colon, you see it's kind of displacing the rectum. So this is urinary, reproductive, digestive. Okay, so female. So this has been kind of significantly modified in a couple ways. First, I open the pelvis so that we can follow the urethra down, and it actually enters into the base of the penis. Also, this thing was once covered by hide, and so were all the reproductive structures. So if I try to paste everything back together, the hide was covering, it was kind of like this. All right. Not a perfect job, but everything was encased in the hide. And then to reveal the structures, you have to, without neutering this poor little critter, or severing any important structures, you have to kind of make some tiny little incisions and then reflect the hide back. And then what you can see would be the testis and epididymis on each side. Where'd the other one go? There it is. Okay. Testis and epididymis on the side. And then the penis is inside this sheet right there. And so there's a cord of tissue called the spermatocord that runs through the inguinal canal. And so if I kind of tug on it, you'll see this is where the inguinal canal is, right here. And so through the inguinal canal is the gonadal artery and vein, and also the vas deferens. So there's the vas deferens on the left side, and then on the right side, here's the vas deferens coming through the inguinal canal on the right side. And the two vas deferens, right and left, come together and form inside of the prostate gland. And so you see where the probe is, it's right on the back of the urethra. And so then reproductive fluids then have access to the urethra, and then the urethra goes down and then eventually attaches to the base, or enters into the penis and travels to the penis as a spongy urethra. And then here's one of the testes and one of the epididymis. Now, it's really hard to distinguish it based on color, but the